Okay, so you guys have given us quite a bit of homework this time.
Yeah.
You threw a bunch of articles at us about acid reflux and GERA,
hmm
specifically about how to manage them with diet. And I think we got some really good stuff here from GER Help, from Healthline, and from Harvard Health.
Yeah, some really reputable sources there.
So what we want to do today is really take all this information and boil it down to something practical.
Maybe actionable.
Yeah.
Definitely.
Actionable insights that people can use to make decisions about what they're eating.
Love it.
And, help people identify foods that are going to be their allies and the ones that are going to cause them some trouble,
Right.
especially if you're dealing with acid reflux and GERD.
Absolutely. And you know what I think is so cool about these sources is that they offer a really nice balance of like quick tips,
Yeah.
but also like a deep dive into the science behind it.
Yeah, and I think that's what our listeners are really looking for, right?
Yeah,
They don't want to feel overwhelmed, but they also want to be well-informed. And, I found some surprising connections in these sources that I think are really going to resonate with people.
For sure.
So, maybe before we get too deep into like specific foods, can we just take a step back and talk about like the core issue here, like what's actually happening in our bodies when we experience acid reflux or GERD?
Oh, that's a great place to start.
Yeah.
So essentially, we're talking about a malfunctioning gatekeeper in your digestive system.
Okay.
And that gatekeeper is called the lower esophageal sphincter, or
Yeah.
LES for short.
Gotcha.
Its job is to keep stomach acid down in the stomach where it belongs.
Right.
But when this LES is weak or relaxes inappropriately, that's when stomach acid can kind of sneak back up into the esophagus, and that's what leads to GERD.
Oh, okay.
And all those uncomfortable symptoms that go with it, like heartburn, that burning sensation in your chest, and even like a persistent cough that some people experience.
So like it's literally like a leaky valve
Exactly.
and it's letting things kind of flow back up.
Yep, backflow.
Yeah, okay.
And, while medications and treatments exist, dietary changes can often be a really effective first line of defense.
Right. So like before we even get into, the heavier stuff, maybe we can manage it just by being a little bit more mindful about what we're eating.
Absolutely.
Okay, so let's unpack this a little bit. When we look at these different sources, what are the recurring dietary villains here? Like, what are the foods that seem to be most commonly associated with triggering acid reflux?
Well, you see a pretty consistent list across the board.
Okay.
Fatty foods are a big one.
Yeah.
And that includes things like fried foods,
Yeah.
fatty meats, full-fat dairy products, and creamy sauces.
Okay, so pretty much anything that's rich and delicious.
Pretty much.
Okay.
Spicy foods are another frequent offender.
Yeah, I can see that.
And then there are citrus fruits. So lemons, oranges, grapefruits, even pineapple and lime
Interesting.
can be a problem for some people.
Okay.
And then we have tomato-based sauces.
Yeah.
Caffeine, which you'll find in coffee, tea, and chocolate.
Okay.
Alcohol carbonated drinks.
Oh, yeah, the bubbly stuff.
And then some surprising culprits. Onions, garlic, peppermint, and even vinegar can be triggers for some.
Wow, that's quite a lineup.
It is.
So it's not just like, inherently acidic things. It's a variety of different types of foods and drinks.
Yeah, and that's what's so fascinating about this is that these foods trigger reflux through different mechanisms.
Okay.
So like fatty foods, for example, they take longer to digest,
Okay.
which increases pressure in the stomach.
Gotcha.
And they can also actually relax that LES muscle.
Oh, so they're directly impacting that valve.
Exactly. They're making it easier for the acid to escape.
Wow.
Now, acidic foods like citrus fruits and tomatoes, they increase the overall acidity in the stomach.
Okay, so that one's pretty straightforward.
Yeah, that one's more intuitive.
Yeah.
But things like chocolate and caffeine are thought to weaken the LES muscle itself.
Okay.
So it's not about the acid content, but rather their effect on the muscle.
Interesting.
Then you have spicy and tangy foods, which can irritate the lining of the esophagus,
Right.
which can amplify that burning sensation of heartburn.
Oh, yeah. That makes sense.
And carbonated drinks,
Yeah.
well, think of it like shaking up a soda bottle.
Okay.
All that pressure has to go somewhere.
Yeah.
And in your stomach, that can push acid upwards.
Wow. So there's all these different ways that these foods can be problematic.
Absolutely.
Now, I know you mentioned that everyone's a little bit different, and I think looking at this list, it can feel a little bit overwhelming.
Right.
Like, where do you even begin to figure out which of these are your personal triggers?
That's such a good point. And I love that the Healthline article suggests trying an elimination diet,
Okay.
where you temporarily remove all of these common triggers,
Okay.
and then you slowly reintroduce them one at a time.
Okay.
And the key here is take a food diary.
Right.
So you track what you eat when you eat it, and any symptoms that you experience.
Yeah, like a little detective work.
Exactly. It's like your own personalized experiment.
I love that. Okay, so we talked about the bad guys now. Let's talk about the good guys.
Yeah.
What are some foods that these sources highlight as being helpful for soothing acid reflux?
Well, there's a few categories that stand out.
Okay.
Green vegetables are a great place to start. So we're talking broccoli, asparagus, leafy greens, peas, cucumbers, Brussels sprouts.
Okay.
What makes them so beneficial is that they're generally low in fat,
Right.
and they tend to have an alkaline nature, which can help to neutralize some of that stomach acid.
Ah, okay, so they're kind of countering the acidity.
Exactly.
Okay.
But there's a little caveat here.
Okay.
GRD help mentions that garlic and onions can actually be triggers for some people.
Oh, right.
So you want to be mindful of that.
Yeah.
And also, how you prepare your veggies matters.
Okay.
Like loading them up with butter or creamy sauces kind of defeats the purpose.
Right, so like steaming or roasting would be a better option.
Absolutely.
Okay, what else is on the good list?
Fiber is another superstar when it comes to managing reflux. And you can find fiber in fruits, vegetables, and whole grains.
Gotcha.
The idea here is that fiber helps to absorb liquid in the digestive tract,
Okay.
which can prevent stomach acid from being easily displaced upwards.
Okay, so it's kind of like creating a barrier.
Yeah, like a sponge.
Yeah.
And GERD Help specifically points out soluble fiber,
Okay.
which is found in foods like oatmeal, barley, and beans,
Interesting.
as being particularly beneficial because it forms a gel-like substance that can trap acid.
Okay, so soluble fiber is like the MVP of fiber.
I think so.
Okay, so we're talking about, swapping out refined grains for whole grains, incorporating more oats and beans.
Yeah, that's a great strategy.
Okay, what about fruit? We know that citrus is generally not good, but are there any fruits that are okay?
There are actually plenty of low-acid fruits that are typically well-tolerated.
Okay, like what?
Melon, bananas, coconuts, apples, pears.
Okay.
The key difference is that they have a lower concentration of those acids that can trigger reflux.
So like citric acid and malic acid?
Exactly. So instead of reaching for an orange, you could grab a banana
Okay, good to know.
and still satisfy that sweet craving.
Yeah, without the heartburn.
Exactly.
What about protein?
Lean protein is the way to go when it comes to reflux.
Okay, so what are we talking about here?
Fish and skinless poultry are great options
Okay.
because high-fat protein sources, like fatty cuts of red meat, can slow down digestion,
Okay.
which leads to increased acid production.
So like grilled chicken or baked fish would be better than a steak?
Yeah, if you're trying to manage reflux.
Okay, makes sense.
Okay.
Now, what about fats? Everyone always tells us to avoid fat, but are there any good fats?
There are actually quite a few healthy fats that can be beneficial for reflux,
Really?
when consumed in moderation, of course.
Okay.
We're talking about fats like avocados, walnuts, olive oil, sesame oil, sunflower oil, flaxseed, and even fatty fish like salmon and trout.
Okay.
And the key here is to distinguish these healthy fats from animal fats and trans fats, which are found in processed and deep-fried foods. And those are definitely the ones to avoid.
So like a drizzle of olive oil on a salad would be a good choice?
Absolutely.
And maybe some avocado toast
Yeah,
instead of French fries?
definitely.
Okay, what about carbs?
Complex carbohydrates are generally preferred over refined carbohydrates
Okay.
because while a high-carb diet can sometimes contribute to reflux,
Okay.
healthy complex carbs that are rich in fiber can actually be really helpful.
Okay, so what are we talking about here?
Oatmeal beans, brown rice,
Mm-hmm.
sweet potatoes, quinoa.
Okay.
The fiber aids in digestion
Okay.
and helps regulate hunger,
Okay.
which can prevent overeating,
Right.
which can then lead to reflux.
So it's about making smart choices within the carb category.
Yeah, not necessarily eliminating carbs altogether.
Okay, so beyond just what we eat, are there any other lifestyle changes we can make to help manage reflux?
There are definitely a few things you can do.
Okay.
Chewing gum after meals can actually help.
Really?
Yeah, it stimulates saliva production. And saliva can help to dilute any acid that might have refluxed into the esophagus.
Oh, that's interesting.
Also, meal timing is super important.
Okay.
You want to avoid eating a large meal right before bed.
Right.
Harvard Health recommends waiting at least 2 to 3 hours
Okay.
because when you're lying down, gravity isn't on your side,
Right.
and it makes it easier for acid to creep back up.
Okay.
Elevating the head of your bed can also be helpful.
Yeah, like with an extra pillow or something.
Exactly.
Okay.
And good posture during and after meals is important too,
Okay.
to avoid putting pressure on your stomach.
Gotcha. What else?
Healthline also mentioned some other helpful tips, like eating slowly.
Oh,
not overeating,
yeah.
maintaining a healthy weight,
Yeah.
avoiding alcohol and smoking if applicable,
Okay.
and even wearing looser clothing.
So, like, no skinny jeans after a big meal.
Exactly.
Okay. Now, all this is great advice, but is there like a one-size-fits-all miracle diet for GERD?
Unfortunately not. All of these sources emphasize that there's no single dietary magic bullet.
Yeah.
And individual triggers can vary widely.
Right.
But Harvard Health makes a really good point that the old recommendation of bland diets is outdated.
Okay.
There are plenty of healthy and delicious foods that you can still enjoy.
That's good to know.
Right.
So it's not all doom and gloom.
Definitely not.
What about drinks? We talked about the ones to avoid, but what are some good choices?
Non-acidic beverages are your best bet.
Okay.
So things like herbal teas and plant-based milks.
Okay.
And you want to steer clear of alcohol, sugary sodas and juices, and caffeine.
Okay.
But Healthline also points out that just sipping water throughout the day can help to wash any refluxed acid back down into the stomach.
So hydration is key.
Always.
Okay. And what about ginger? I know a lot of people talk about ginger for digestion. Is that something that is recommended for reflux?
Well, Healthline kind of presents it as a double-edged sword.
Okay.
It does have anti-inflammatory properties and may help with gastric emptying, but it can also trigger heartburn in some people.
So like anything else, it's really about listening to your body.
Exactly.
Okay. So if we had to sum this all up, what are the key takeaways here?
I think the most important thing is to focus on incorporating those helpful food categories.
Yeah.
So lean proteins, lots of veggies and fiber,
Right.
low acid fruits, and healthy fats.
Okay.
And then be really mindful of your personal triggers.
Right.
Experiment with that elimination diet
Yeah.
and see what works for you.
Because everybody's different.
Exactly.
And I think it's really important to reiterate that all this information is based on the sources you guys provided.
Absolutely.
This is not medical advice.
No.
If you're having serious issues with acid reflux or GERD, talk to your doctor.
Right.
Or a registered dietitian
Yep.
to get personalized guidance.
Absolutely.
But I think this is a really good starting point,
For sure.
It's just to be more mindful of what you're eating and how it might be impacting your reflux.
Yeah, and to empower yourself to make some changes.
Exactly. So I'm going to leave you guys with a little challenge this week.
Okay.
Think about one small dietary change you can make based on what we talked about today.
Love it.
And just see how your body responds.
Yeah. Pay attention.
Yeah. It might be surprising what you discover.
You never know.
And if you found this deep dive helpful,
Yeah.
we encourage you to share it with your friends and family.
Spread the knowledge.
Yeah. And don't forget to subscribe to the Detox Health channel for more insightful deep dives into all sorts of health topics.
See you next time.
Thanks for listening, everybody.